Hey, welcome to Bioscan Hub. If you're here to really get a handle on the core techniques of laboratory science, then you are definitely in the right place. Go ahead and hit that subscribe button. It really helps us out, and you won't miss a thing. All right, let's jump in.
Today, we're tackling an absolute cornerstone of the medical lab, urinalysis, and we're going to get really specific and master the chemical reagent strip. You know it as the dipstick. Now, for any of you who are medical lab students, listen up. This isn't just another test. It is one of the quickest, most information-packed screening tools you will ever get your hands on.
So I want you to think about this for a second. We tend to dismiss urine as just waste, something the body gets rid of. But what if it's not that simple? What if it's actually a super detailed report, a liquid printout of what's happening inside our bodies? Well, as you're about to see, it's packed with clues about our metabolism, making it an incredibly powerful tool for diagnosis.
Okay, so here's our game plan. First, we're going to cover the why we call urine the body's report card. Then, we'll take a peek inside the kidney's amazing filtration system. After that, it's all about the how. We'll walk through the whole urinalysis process, really zero in on mastering the dipstick, and then finish up with the crucial rules you have to know to get accurate professional results.
All right, section 1. Let's dig into why we call urine the body's report card. It might look simple, but the clinical significance packed into this fluid is just incredible.
So what is urine really? At its most basic level, it's an ultrafiltrate of plasma. But the sheer scale of this process is mind-blowing. I mean, think about it. Every single day, your kidneys filter around 170,000 milliliters of plasma. That's like processing an entire bathtub full of liquid. And from that huge volume, they expertly grab back everything the body needs, leaving only about 1,200 milliliters of super concentrated information behind. It's just a stunning piece of biological engineering.
And because of this brilliant process, urinalysis is one of the most valuable screening tools we have. You know why? It comes down to two simple things. First, getting a sample is incredibly easy. And second, that sample is just loaded with data. This combo makes it the perfect, low-cost way to screen for major issues like renal disease, diabetes, and liver disease, often long before a person even feels sick.
So how exactly does the body create this super detailed report? Well, that brings us right to section 2. We're going to go microscopic and take a look inside the kidney's remarkable filter, the nephron.
Each of your kidneys has over 1 million of these little powerhouses. The easiest way to think about a nephron is as a two-part system. The process kicks off in the glomerulus. That's this tangled little ball of capillaries that acts like a first-pass filter. From there, the fluid moves into the tubule, and this is where the magic really happens. The tubule is incredibly smart, selectively reabsorbing every last thing the body wants to keep while actively pushing other waste products into the fluid that will eventually become urine.
Now, this is where you can really see how incredibly selective the kidney is. Just look at glucose. The body filters about 140 grams of it every day, and in a healthy person, it reabsorbs 100% of it. 0 gets excreted. Now compare that to creatinine, a pure waste product. We filter 1.4 grams, and we excrete all 1.4 grams. This isn't just a simple filter. This table proves the nephron is a highly intelligent, discriminating system.
Okay, so now we get how urine is made. So let's talk about how we actually analyze it in the lab. This is section 3, the 3 stages of a complete urinalysis.
A complete urinalysis, which you'll often see abbreviated as just a UA, has 3 main parts. First up is the physical exam. This is where we're just looking at it, noting the color, the clarity, and measuring its specific gravity. The second part is the chemical analysis, and that's the star of our show today. This is where the dipstick comes in. And finally, there's the microscopic exam, where we centrifuge the urine and look at the sediment under a microscope to find cells, casts, crystals, and all that good stuff.
And that brings us right to the main event, section 4, mastering the dipstick test. I'm telling you, this little strip of plastic is one of the most powerful and efficient tools in the entire clinical laboratory.
I absolutely love this quote. It's so true. Dipsticks might just look like little pieces of paper glued to a plastic stick, but they are in fact miniature laboratories. Each one of those little colored pads is loaded with specific chemicals, all designed to react with something in the urine. That reaction causes a color change, and that color change tells us what's there and, roughly, how much of it there is.
So what kind of stories can this mini lab tell us? Let's break down some of the key tests. We've got pH, which gives us a peek into the body's acid-base balance. Then there's protein, which is a huge indicator of kidney disease, since it shouldn't be getting through that glomerular filter. Glucose, as we already know, should be completely reabsorbed, so finding it in the urine is a classic sign of diabetes. And ketones? Well, those are byproducts of fat metabolism, and they often pop up in cases of uncontrolled diabetes or even just extreme diets.
And there's more. The strip also tests for blood, which can signal anything from a simple infection to more serious trauma somewhere in the urinary tract. Leukocyte esterase is an enzyme that's found in white blood cells. So if that pad turns positive, it's a huge clue that there's a UTI. That's often confirmed by a positive nitrite test, which tells us that specific kinds of bacteria are present. And finally, bilirubin and urobilinogen are absolutely vital for checking out liver function and spotting potential blood disorders. Look, knowing what the test can do is one thing, but now we get to the part that truly separates a student from a professional technician. Section 5 is all about accuracy and the absolute non-negotiable rules of urinalysis. Getting this procedure right isn't just important, it is everything. So let's walk through the 3 critical steps. 1. Dip. Dip the entire strip into a well-mixed sample, but do it briefly. 2. Blot. Pull the strip out and immediately blot the edge of the strip on something absorbent. This gets rid of excess urine. 3. Time and compare. This is crucial. Hold the strip flat so the colors don't run into each other, and compare each pad to the color chart at the exact time the manufacturer tells you to. Timing is absolutely everything here. And this slide shows you exactly why that procedure is so strict. For instance, if you leave the strip in the urine too long, you can actually wash the chemicals right off the pads, which could give you a false negative result. If you don't blot it right, the colors from one pad will bleed into the next, we call that runover, and totally mess up your results. And reading it too early or too late, you're just going to interpret the color wrong. These aren't just suggestions, they are fundamental for getting a valid result. And finally, we have to talk about quality control. This mini lab is a sensitive piece of equipment, and it's only as good as how you treat it. First, and this is a no-brainer, check the expiration date. Never, ever use expired strips. Second, store them right. Moisture is the enemy, so that cap has to be on tight. Third, here's a pro tip, you have to throw out any bottle that's been open for more than 6 months, even if it's not expired. And fourth, every time you open a new bottle, you have to run liquid controls, a known positive and a known negative, to make sure the strips are actually working right. So there you have it. The dipstick is this incredibly powerful tool that lays out the chemical story of the urine. It gives us this fast, detailed picture of what's going on metabolically. But it's just one part of the story. The chemistry can point us in the right direction, for sure. But what about the secrets hiding down in the sediment? You know, the cells, the casts, the crystals. Well, that's a story for the microscope.